We're excited to have you. I think it's kind of slowly letting everybody in. I'm going to keep accepting everyone. So thank you guys and welcome to our webinar today on launching pharmacy as leaders. We're going to talk a little bit today about Cascadia Pharmacy Group and really what we've done with pharmacy and where we see the profession of pharmacy heading. We've been formed about 1.5 years, but Jeff and his pharmacies have been around for many, many years. Crystal and myself have worked with them for several years, and Amanda as well. And so we're excited today to talk a little bit about just generally Cascadia Pharmacy Group engagement with the profession, but also a lot of learning opportunities with us, including internships and residency programs. A couple housekeeping things. We will record this and we will be emailing it out afterwards. So if you aren't able to attend the whole time, or if you want to share it with some of your classmates or friends or colleagues, we will be disseminating a recording to you, as well as through your local universities as well. We did receive questions when you registered, so thank you for that. There is a great number of questions. We're excited to answer those today. But if there are any questions that you have as we go throughout it, we did disable chat, but the Q&A portion is open. So you can utilize that to ask any questions that you have. And so with that, we'll go ahead and kick off introductions. I'll go first. I'm Tara Fund. I'm a pharmacist who is a residency program director for the Cascadia Pharmacy Group residency program. But I do a lot of different things involved with residency programs over a lot of years. I had a history at a long national regional chain, and I helped, first I was RPD for a local program, working with 2 residents, and then I started to oversee residency programs across 36 states, and I worked with about 26 different residents. So I've found myself in kind of cutting edge, pushing the envelope on pharmacy profession most of my career, and as I started to work with Jeff and Crystal at Cascadia Pharmacy Group the last 1.5 years, I found myself in similar roles, and so that's a little bit about me. Crystal's worked with me a long time, so you want to tell them a little bit about you?
Yeah, hi, I'm Crystal Bryan, and I started working with Tara actually as a community practice resident in 2012. Since then, I've served in a number of different roles, lots of clinical focus, community practice focus, and some leadership, some dabbling in technology even. And so it's been a pleasure to be with Cascadia Pharmacy Group the past 1.5 years and to participate in precepting students and obviously the residency, which we're here to talk about today. So I'll pass it to you, Amanda.
All right, thanks. Hi, everyone. My name is Amanda. I'm one of the first year and inaugural pharmacy residents here with Cascadia Pharmacy Group. I've loved it so far. We're about 4 months in, and it's going great so far. So I'm very happy to chat with y'all today. And then my history is also, I've done rotations with CPG preceptors and just really enjoyed it, and actually really motivated me to join the residency. And then when I met Tara and Crystal, we actually had lunch with Julie as well during one of my rotations, and I knew I found my home. So yeah.
The person bringing us all together is Jeff. So Jeff, you want to introduce yourself and kind of kick us off?
Sure, absolutely. Good evening, everybody. Thank you for being here for our program. My name is Jeff Farrell. I am a pharmacist, CEO, and founder of Cascadia Pharmacy Group. Our group, as the ladies have said, is about 1.5 years old. Although we have had the pharmacies in place, it's the management group that we put together to kind of connect the dots in our network of pharmacies over 4 states. We've grown pretty rapidly. It's been exciting, and we love what we're doing, and we're passionate about independent pharmacy, and look forward to presenting to you guys and then answering any questions you might have as we follow or finish up. So let's talk a little bit about Cascadia Pharmacy Group and who we are. Cascadia Pharmacy Group is a management company, just so that everybody's aware that has a master service agreement to manage and do all of the back end stuff on the pharmacies. We have 45 locations now in 4 states. And the current model allows our pharmacist partners and pharmacy managers to really just focus on the patient care, patient-centric, front-facing, pharmacist duties that oftentimes in today's world get muddied with all the red tape and different hurdles that we have in pharmacy as an industry as well. The one thing that Cascadia Pharmacy Group does is we work as a team and we work as a family. And I know I've said it a million times, but as you can see up there, that picture is the majority of the partners and managers. And there's not 1 second that we don't share our wisdom, our resources, buying power, best practices, keeps everybody sharp, keeps everybody focused, and also gives everybody the tools to succeed in the roles that they're in, by having that support, and empowering each other. So what are we aiming to do? Well, honestly, we're empowering independent pharmacies to excel through collaboration, innovation, and exceptional patient care. What we're also trying to do is to keep independence independent and in those communities where patients need us most. With the consolidation and the recent closures of pharmacies, obviously there's a lot of news in that with Rite Aid and different things, but we're growing, we're not closing, and we are actually going out there and finding pharmacies to keep alive. It's a passion of mine, it's in my blood, and the team that we have believes on the mission, and that really is to keep these pharmacies up and running and going, not let them close, and then empower that partner, that manager or resident or whomever to practice at the top of their license and to be able to deliver, care and the skill set that they need to make sure that our patient care is exceptional. I do believe that, with Tara's work, and in this space with the clinical services and some of the different things that we can do in the billing area, that we are going to transform that, and we are going to really be able to start working with the payers and to do some cool things that are not just count, lick, and stick and be handcuffed by the prescription. We're real close. The team's been working really hard, and I think that in 2026 that we're going to have a pretty robust program and working with the payers to improve patient care, patient outcomes, and then also get paid for it at the pharmacy level.
Can I jump in for a second?
Absolutely.
Julie, could you go back just one more slide to the picture of everybody? Jeff was talking about the family feel and the passion behind our group and how we're able to do these pilots for medical billing and push things forward. And I really believe that comes down to the people that Cascadia Pharmacy Group is comprised of, starting with Jeff. He is the immediate past NCPA president. If you look at this picture, Michelle's front and center in the white jacket. She's also an NCPA past president. We have a lot of the preceptors for our rotations and for the residency are involved in NCPA standing committees, their state and local pharmacy associations, and they all have something really special going on. And so that's another thing that makes not just Cascadia Pharmacy Group unique and special, but also our internship opportunities and our residency too. There really are passionate movers and shakers from top to bottom.
And you get to learn not just from that one store, that one team you're with, but from many, many different stores and a variety of independent pharmacies, because they all look and feel so differently. And because we all work together and bounce ideas off each other, we have meetings where we all come together, and both in person and virtually, you're able to really learn from multiple different pharmacists and pharmacy leaders in 6 weeks or a year with us too.
Yeah, I think I've met most of those people in that photo. Which is a really cool and unique experience.
Yeah, especially going to the owner's retreat, I bet.
Yes, it was so very cool.
So I'll wrap up a little bit on who we are and what we are before we get into some of the meat and potatoes of the programming. But we've grown to 45 locations. We will be roughly at 50 plus by the end of next year. I think we'll probably be closer to 60. All really good pharmacies that just need a little influx of energy and support and structure. And so we've got a lot of people reaching out to us to either acquire or merge, so that they can be part of the group. One thing I realized probably back in 2008 when I first started and kind of started putting things together was, we needed to get to some scale, some critical mass. Although a single pharmacy owner can do real well, it's easier when when you're able to have the resources that we're able to put, to the pharmacies. That picture that Crystal highlighted, every single one of those is one email, one text, one phone call away, and everybody's answering within 5 minutes, and so you have resources that you just don't get when you're out on that island. And then also, we get the buying power, and all the different things that come along with getting bigger. So the need for scale, the critical mass, the strength in numbers, it's what makes Cascadia Pharmacy Group tick right now.
And you always talk a lot about our premium products, kind of merging all those stores together and creating the best in class. And I think that symbiotic relationship that we have really helps us get there too, for sure.
Absolutely.
So you want to tell us a little bit about your vision and kind of what you thought of when you created Cascadia Pharmacy Group, Jeff?
Yeah. So I know this by firsthand. I bought into my first stores in 2006. And, we were doing it all. I was sleeping on the floors of the pharmacies, doing server upgrades, having to do payroll late at night, dealing with, trying to do marketing, your local newspaper and this and that. And as we started to grow, I started to see that we were going to have to do the things that the chains do. I didn't want to be a chain, but the things that the chains do is they have operational seamlessness in the back end. They have consistency. They do the same things over and over. And so I really started to see Cascadia Pharmacy Group bloom probably 5 years ago, but we didn't put it together until about 2 years ago, or coming up on 2 years, where we've got a team of people that just supports the stores. So each individual store has a contract with CPG, and CPG's team, Cascadia Pharmacy Group's team, is about 13 to 15 of us, I believe, that do nothing but to support the stores, whether it's payroll, IT, marketing, credentialing, contracting, the buy side, the sell side, with the contract, the fraud, waste, and abuse, HR, you name it, all of that stuff is handled by CPG and streamlined on the back end. And basically, that's the consolidation of the admin. And it really frees up the partner, the pharmacy manager, the pick, to be that pharmacist that they've gone to school for, to deliver that ambulatory care, to deliver those prescriptions in a manner that is uninterrupted by, the back end day-to-day admin stuff. And so that's really why we put it together. It also allows us to grow really quickly. The team can lay down the gauntlet pretty quickly and get a store moved over, with the processes and the continuity of communication and operations that we put together. So it's exciting. We're growing. We're going to have to continue to grow and restructure so that we can support that. But at the end of the day, what we've put together, that symbiotic relationship, is really, I think, some of the secret sauce to why our stores are successful at the moment.
And really creates kind of a new generation, a new look and feel for pharmacy in general, but especially independent pharmacy, I think.
Absolutely.
And you mentioned not wanting to be like the chains. And I think that's another thing that's so special about how you have so many partners in different geographical areas, is that the pharmacist that is the face of the pharmacy is invested in not just their business, but their whole community. And you really feel the difference when you walk into a pharmacy that's affiliated with Cascadia Pharmacy Group or another independent pharmacy. It really does feel truly independent and not that standard major retailer look. So
well, and we keep the names of the pharmacies the same in their community. So we're not, everything's not Cascadia Pharmacy Group, Cascadia Pharmacy Group, Cascadia Pharmacy Group. We're powered by, we're affiliated with, we're a partner of, but each individual store has their own autonomy in their community, and that's what what your patients, your community members, wouldn't necessarily even know that who and what Cascadia Pharmacy Group is, because those stores still have their hometown flavor.
Mhm. All right, so this next slide is talking about why choose a community-based residency. And as I said in my introduction, I chose to do a community practice residency back in 2012. And when I was in school, I always felt there was a lot of pressure to go into clinical, right? Go hospital, go AmCare. And those were big, attractive, catchy words. And so that's what I was pursuing. But over and over in my rotations, I felt more connected to the patient, the community, the purpose when I was actually in the community setting. Because I wasn't just per protocoling some standard Coumadin dose. I was actually connecting with the patient, understanding what were their barriers to care, helping them with, whether it's dietary stuff to supplement some of their other chronic health conditions, or maybe it's prior authorizations and figuring out how they can afford, or looking at the data to help them understand the why. And so I just really felt connected to the community practice setting. And when anybody says that they want to pursue clinical, I get really animated, I guess, and say that clinical is community. Clinical practice is in the community setting. And you'll hear it over and over if you talk to any of our residents or our pharmacists. There is more clinical practice that happens, especially in a rural community setting. But even in our really urban stores, there's a ton of wonderful interventions that happen every single day. And so I think instead of listening to the shoulds of this world, really see what connects to your soul. What is your passion? Where do you want to help people? And I love the longitudinal aspect of the community setting, because you don't just see somebody when they're really sick and on a controlled TPN or hospital diet. You get to see what it's really like when they're home and how you can actually connect with them and make that difference. And so anyway, in the end, I flipped and I chose to pursue a community practice residency, and it was the best decision I could have made. And then the other thing is, right, that I heard was, how come you didn't just go get a job? You could go be a pharmacist and make more money. That's kind of the elephant in the room. But I personally felt that I had invested in my education and learning for the previous 7 years. Some of you have gone even longer. And I didn't want to stop. I didn't want to just go be a pharmacist and be judged on how many prescriptions I can fill, and that's it, clock in, clock out. I really wanted to invest in my education, invest in my learning, and be surrounded by a pool of people that would equally be pouring into that, right? They're going to help me do self-assessments. They're going to be seeing things that I don't see. They're going to be pushing me into opportunities that make me feel uncomfortable and will help me grow. And so it was wonderful. I had a whole year, and Amanda's getting a whole year. She's getting close to halfway through, where people are helping you learn, and you're getting to expand your network. You're meeting people from not just across our 4 states, but you get to go to national conferences and meet people from across the world. Well, at least the nation, but truly across the world too. There were some really great people that came over from Australia to NCPA that we got to meet with, and Michaela, one of our residents, even did yoga alongside one of them, and it was great to connect and hear how pharmacy works in other countries too. So you're expanding your network, and through doing that, you're expanding just your personal and professional growth. How do you handle stress? How do you break down major projects? How do you teach, whether you're leading a small didactic, a large class, maybe doing one-on-one precepting or mentoring? What about developing business plans? If you're really interested, especially in ownership, or want to pursue something more clinical, how do you make the business case for it? Because we can pull at heartstrings all day and want to make an impact on patients, but we also have to make that sustainable. And those are things that you get to do as a community practice resident that you wouldn't get to do. You wouldn't have the time or flexibility to often do if you just go out and be a staff pharmacist. Research is another one. Leadership. How do you We put people in different presentations on different projects, and we're really helping them develop even book clubs, right? How do they think about the world? How do they think about working with other people? Opportunities to present, like Amanda's here right now on her webinar. Is this your first one, or did you do some in school too?
I did like similar like talks, but nothing is like really cool and like, I don't know, official as this. This is like amazing.
I know you did some podcasts, so it's
Yes.
not your first rodeo, but financials is another one, right? Business plan, you're making the case for a project, but how do you look at a P&L? How do you understand profitability? Yeah, I just think a community practice residency really opens the doors and is worth it. It's worth it time and time again. You really do get 3 to 5 years worth of experience in 1 year, and it's done nothing but open doors throughout my career. I know Tara could say the same. And so it's definitely worth considering. Just think about what is your passion, what is your why, and where do you want to be a year from now?
Yeah, when I chose to do community-based residency, a big part for me too was the ability and that flexibility to chase that why and not have that for when you have a job, you have a job and you work on what you're told to work on and what you're supposed to work on, what you have to work on. And of course, there's subcomponents of that built into your residency, but it's also built around chasing your interests and building something and trying and maybe pivoting away from. And that's okay because it's in a safe learning space with a lot of peers and a lot of colleagues and that flexibility to try different things that unlikely your entire rest of your career, you'll have that opportunity to do.
And I, as one of the residents, really can officially say, yes, I feel that in this residency. I feel like I can ask any question ever. Like it's never a dumb question. I'm supported at every level. I can learn and like make mistakes and learn from them. And Crystal basically stole all of my words for later, so I'm gonna have to noodle on all the things I was gonna say. So, but yes, no, yeah, it's been amazing.
You'll get to think quick on your feet. So why choose Cascadia Pharmacy Group? So I want to back up just a little bit to compare what do different residencies look like. So with a hospital residency or even throughout your rotations in your last year of school, you get a lot of chunks of learning, right? I'm going to learn internal medicine, I'm going to learn peds, I'm going to learn HIV, I'm going to learn community practice, and it's 6 weeks at a time. With a community residency, we have longitudinal learning. So you get a bit of each of your experiences, your core learning blocks, but they're spread out throughout the week or throughout the month because what you learn as under your ownership or clinical hat or your community practice hat, all of those layer on each other and help you become a better practitioner or know more in the different learning experiences. So they're all longitudinal. The other benefit of that is that when you're staffing on Mondays, let's say, you're going to be more likely to see those patients again and again throughout the year. So you get the same touches with the same people, and that really supports an awesome learning experience. So instead of being a really blocked learning, think longitudinal. And then the other big difference with Cascadia Pharmacy Group is that we are not accredited. So we won't go through forecasts. I think I said the right one. But what
Yep.
that does is it gives us a lot of flexibility and opportunity to make this residency your own. Now, there's still a lot, especially with Tara. She has learned, or she created residency programs. She was the first resident for our program. Then she led residency programs throughout the state that were, or throughout the nation that were all accredited. So she brings a lot of the structure that helps support a solid residency program. And we're not so locked in by ASHP or these standards or accreditation. So if you really wanted to flex up on teaching, because you're certain you want to go into academia, that's a possibility. If you really want to dive deep into research or ownership or whatever, we have opportunities to flex and tailor your residency program, especially for you. Let's say you're really interested in compounding, right? Eric Nelson has a state-of-the-art facility in Spokane, and we would push you more to there if you want to go compounding instead of Goldendale, where they don't have a compounding lab. So lots of opportunities to get something that really meshes well with you and your long-term goals by having this community practice, longitudinal rotation, that's non-accredited. And now we're expanding to 10 sites, and there are even more opportunities to get something that really, really fits your long-term goals. So, and then obviously clinical. So being with Cascadia Pharmacy Group, being in the Pacific Northwest we're biased, but it's a really special place to practice pharmacy because it's very progressive. And so if you look at Idaho, they have independent prescribing. Washington is a collaborative drug therapy agreement, or CDTA. It's like a CPA, collaborative practice agreement, that all the other states use. But that's what we have in Washington. And we have over 20 collaborative drug therapy agreements. We have CPSN programs, and we can do a lot of really cool things. They're listed here. Oregon is a little bit different than Washington in that it's not by a collaborative drug therapy agreement. It's a statewide protocol. But those 3 states are all super progressive in what pharmacists can do. California is newer to us, but I know that they were one of the first states to push hormonal contraception, so they're pretty progressive as well. If we look at some of our clinical programs, if you want to start to get excited, I'm not sure where everybody on here today is coming from. I know we have New York, I think we have some Georgia, and so practice looks different in your part of the country. But here we can actually prescribe for allergies, burns, human and animal bites, which may sound weird, but if you go to Goldendale, there are more bites than anywhere else. Shingles, we can actually diagnose and start early intervention for shingles, which is wonderful because with the time that it can take to get into a provider's office, especially if, let's say, you're on Vashon Island. You're literally on an island. There is no bridge. You have to take a ferry there. Or away from there to go seek care. And so you can go straight to Vashon Pharmacy, and they have a wonderful team that can help take care of you for these things. UTIs, yeast infections, refills can be important, right? For EpiPens, inhalers. So we have a whole slew of things we can prescribe refills for. The ones I get really excited about is chronic disease management, where we can actually start to create a panel of patients where we provide that chronic care. Asthma, diabetes, hyperlipidemia, hypertension are the 4 primary. Tobacco cessation is a big one that happens a lot in Grants Pass and Southern Oregon. We have payer programs that Tara worked on to support payment to make that actually sustainable. Travel consultations, if you want travel, go to Seattle. Caterman's Pharmacy is a bustling hub of travel. They give more vaccines than I knew could be possible. And the whole community trusts them, right? They trust them with not just what vaccines they need, but what medicines can we give for altitude sickness, malaria, etc. And Lord knows how many mosquito nets and other alternative things they are able to help support patients with as well. And then obviously vaccines, which happen nationwide, but we have very progressive rules around vaccinations in our 4 states. So.
And a fun fact is like these types of services and implementing them, setting up pharmacists to be in network with medical payers, how to chart, code, document, and getting paid, revenue cycle management. Crystal and I working on that, we started to work with Jeff's Pharmacies. And that was kind of how that connection was formed several years ago, was utilizing and implementing these advanced services. And his pharmacies were primarily the ones we worked with because they were, premium product pharmacies really ready to push the envelope on what that profession looked like. So kind of neat. So I'll talk a little bit more about kind of the logistics of the residency program. We do have a pretty robust website. I have a QR code in a couple slides that I'll put up. So I won't go into too much detail because it's kind of all laid out up there. But like Crystal said, we try to follow kind of the backbone of an accredited residency program. So you've got that structured learning, you've got your quarterly customized development plans, you've got your performance evaluations, you've got preceptor development, you have a longitudinal research project with quality improvement and business plan. But at the same time, you're also kind of focusing in on one store location. That's, again, part of this bigger ecosystem, part of this family of pharmacies where you're learning from many different people, because Amanda's pharmacy might not do as many bites. Maybe the people in Seattle don't bite like they do in Goldendale, but she works closely with Michaela, and she can hear about what that looks like up in Seattle. So what we do is we have designed it to be about half of the time is truly in that pharmacy. About a day a week is allocated to really replacing a pharmacist in workflow, staffing, really understanding that meat and potatoes of being the best pharmacist you can. And we built out kind of a staffing checklist component that has kind of a quarterly progression: intern, staff pharmacist, PIC, manager, or regional. Many of our owners own 3, 4, 5 pharmacies. And so kind of try to have that progressive ability to work in the pharmacy, but also building clinical programs. So a lot of our stores are already doing things, but we still don't have patients knowing to come yet. So it's working on marketing, helping patients get in the door, and helping to have the entire team be comfortable doing services and being as progressive at travel as Catermans. So honing in on clinical services and building those and executing those. And just today, Amanda was working with our lead of CPSN Washington on how we can help all of our stores understand the new BI dashboard and better execute on the Elevance program. And so she's, again, taking it for her stores and also being able to share that learning with 45 stores. So it's really unique and neat to be able to work with so many different peers. So that kind of folds from being the store hat to kind of the larger hat in the larger ecosystem of helping to build clinical services, working with us on payer programs. We've got Jeff is constantly talking with the payers. I have a long history of talking to the payers. I just was on a work group call a couple weeks ago, got reached out from one of my past colleagues about how we can get something going at Cascadia Pharmacy Group. We have a lot of really unique opportunities, and the residency programs are really how we're going to help make those things come to fruition and continue to execute and implement those. We've got a lot of exciting research projects going. Amanda's going to talk, I think, a little bit more about what they're looking like this year. But this just being our first year, we have good collaboration with our colleges. I've luckily worked with both universities in my past career in residency programs, so already had that footing of how we can really develop a strong research project, quality improvement, and business plan. So we can start to, create those posters, those publication opportunities, presentation opportunities to help share all the great things that we're doing. We do fold in teaching certificates for all of our residents. We've got 2 different college collaborations, but that is a big part of it. And again, if that's a huge interest, there's opportunity to do more. And if it's something that, just kind of the core exposure, we still also have that. There is an in-person component for both university collaborations to that too. So we do engage the resident in that. And then finally, professional development leadership. That's very, true to all of us. As Crystal said in that intro, and we're looking at the slides, all of us are very involved and passionate about pharmacy. And even in the social hours, talk about pharmacy because we love it and we're excited and we live and breathe it. And so we really believe in that value of creating that network. And so if you go to a conference, you see Cascadia Pharmacy Group, you're like, well, that group's here. Like, they are showed up in a big way because we are very, very passionate about it. And so we do have that be a structured part of the learning, as well as book clubs and TED Talks. And Crystal and I, for many, many years, have done residency programs together. And there's so much value pulling together that time for that personal reflection and growth. And we have interns too. I know Amanda will talk more about it as well, and I will talk too, but we have remote business administration student rotations students that are also working with the residents on things like, professional development and growth. So as Crystal mentioned, it's longitudinal. So you might be there staffing every Monday, and then now you're like, oh, that's that patient that has diabetes. That would be good for me to implement this Medicaid program on, as I'm starting to get this new service going. And so that's another really nice thing about being in that store, in that community, really helping push that envelope, wearing all the hats of developing clinical services, providing clinical services, as well as staffing that pharmacy. The next slide is a map of all the different locations. We've got University of Washington, 5 collaborative sites, and WSU, 5 collaborative sites. This year, actively, we've got 3 community-based residents. We've got 1 in Centralia and 1 in Goldendale, and then Amanda's up at the Ostrom's one. And a lot of our stores, they work in more than one pharmacy. Like Amanda goes to a couple different ones. Our Centralia resident goes to a couple different ones. So there is the ability also to understand a few different teams, but we try to put you at one main hub so you can really get into that community, get those services going, and really grow all the things of helping to manage a team and work with the different personalities of the different technicians and clerks. And you get all of those aspects living and breathing in that store, while at the same time understanding and building this big family network within the Cascadia Pharmacy Group ecosystem. So as you see, they're kind of spread across Oregon and Washington. And you could move on, that's great. And then lastly, kind of some things that we're thinking about for residents. You know, as a common question we get, it was something that was definitely submitted in advance too. What would be like a good resident at Cascadia Pharmacy Group? I remember last year when we were starting the recruitment process, I got asked that question a lot. And one big thing I always say is adaptability and agility. There's so much creation in this residency program because we have so much to do at Cascadia Pharmacy Group. So many exciting things. Like the opportunities are everywhere we look. And as we continue to grow and build this infrastructure of clinical leads and clinicians in our stores, we're going to do more and more of them. So somebody who knows that and knows that they aren't coming into something that's been done for the last 10 years this way. We are figuring out how to do it, how to best do it, learning from that, and then pivoting as we've learned. And so somebody who's really excited about the opportunity to try things, learn, grow, pivot, expand. And then obviously very engaged with community and business ownership. You've got a team of star business owners, star pharmacists, clinicians, some of our pharmacy managers or PICs that aren't owners are still amazing leads in our profession. So somebody who really wants to push that envelope and be that person that changes pharmacy and leaves that impact in their community, both locally and a larger scale as well, because we have so many partnerships and collaborations. Somebody that's something that is their why will definitely have a good time in a residency with us. And then lastly, the lifelong mentors and friends. Crystal, like we've worked together basically our entire career since 2012. Amanda's worked with us for several years. I mean, we had worked with Jeff before we even worked with Jeff. There's just so much connection between everybody. And I think that's a huge, huge value add to our program. The next slide has the QR code for our residency website. And so if you want to scan that, or you can go to Cascadia Pharmacy Group. Our application is not through the ASHP match. It is through our website. If you go there, you'll see there's some kind of just basic questions like tell us a little bit about you. And then we ask for 2 letters of reference, your transcripts, and a letter of intent. So it's kind of all built out there. We do have 10 sites like we mentioned. And so what we built out this year is an ability to rank them. Let's say you're like, I want to make all 10 sites. I'm open to the different opportunities, but I don't even know which one. You can rank them all 1. And we can kind of talk through what you're looking for and maybe narrow it down, or you could always interview with everybody. You could say, I know I specifically want to go to Goldendale, and just put that, and you could say not interested in the rest. So there's an opportunity to kind of indicate your preferences, since our residencies are all intertwined with the Cascadia Pharmacy Group overlap, but they are also still in their own ways very different. And so sometimes it's location or people that help you drive what you pick, or sometimes it's the opportunity, and I can help kind of match you up in the right way as applicable. And that's us at WSPA. All 3 residents are in there, and all the rest of everybody's some of our residency preceptors. So I know Amanda collected some fun pictures on the next slide.
Yes. We've been, one of my projects that I've been working with Julie and Tara and Crystal and everyone on is marketing for the residency, and also with my preceptor Matt Binder in Seattle for his stores. So I've actually been getting to like open my creative brain a bit with it as well. So it's kind of been a really cool like pharmacy creative mesh. I love it. So just to kind of touch on all the pictures we have here a little, I want to echo everything that Crystal and Tara have said. So far, I mean, we're only 4 months in, and I feel like I've very much already worked like 5 years in the last 4 months in a good way, because that's what I wanted. Like I was the type of student who was like, I don't want to go just to work. I wasn't super interested in working in a health system, and that is, some people want that, and that's great for them. Just for me, I wanted that patient connection. And so when I did my rotation with Matt, my current preceptor at his pharmacy, fell in love again with the community pharmacy that I've always been loving, and had never been in an independent community pharmacy. So if you're looking to do like a rotation, and that prepares you for either a residency like ours or want to do a rotation with any of our sites or an admin with CPG, I highly recommend it because I think it's just such a unique experience. I really actually wish I could have been involved even sooner and done even more rotations with CPG, but hindsight's always 2020. And now I can share this knowledge with y'all and hopefully change your paths for the better. So yeah, but many opportunities that we've been able to have me and my co-residents. So some of the pictures here, like top left is us visiting one of our sites. Joe Swaz, a preceptor this year as part of our 10 sites. We went and visited his pharmacy in Forks, Washington. Very cool to go see, how that pharmacy runs. We actually did a whole little half work day where we were in the pharmacy, seeing how they operate, learning the tips and tricks of their workflow. And Sharina, our manager, who's standing in that picture as well, she is actually taking some of those ideas and implementing it into Ostrom. So it's just the collaboration is super there. It's very I call it the Farmily, and I absolutely love our Farmily. Bottom left picture there is us at the owners meeting. Me and my co-resident Anna are in there. This is actually also our fantasy football group with some of the owners. And I was winning and now I am not winning, and that's okay. But just the collaboration on just a professional level has been, it's actually also one of the reasons why I chose CPG too, is just because the people. I mean, you've already mentioned, Crystal and Tara, the passion that people have, and I am someone who has so much passion for community pharmacy, and I could not have dreamt of a better match of a residency for myself. I feel very lucky that I'm able to do this with y'all. So yeah. And then we have some pictures here as well with some of the students on rotation. So that's me with selfie with a couple of our rotation students that are interns with my sites, and then also had done a CPG rotation. So Catherine did a rotation as well at Madison Park, one of the other 3 sites. Anna did a tabling event in the bottom middle where she was handing out informational leaflets and flyers to patients in the community and just connecting with the community from the pharmacy. And some of the other photos I'll talk about, especially the top right photo, is actually a little cocktail hour or happy hour that me and some of the CPG admin rotation students and the co-residents got together and collaborated on to just kind of chat, hang out, because a lot of the times we were interacting with the students just with projects and things, and we were like, hey, let's, Anna, our co-resident, really stepped up and said, hey, let's do a happy hour. And so there's a lot of connection throughout. And then the bottom right is the co-residents in New Orleans, where we just recently went to NCPA and got to see Jeff do his presidency, wrapping that up, and just hang out with all the owners and just really connect. Just briefly, I'll mention some of my projects I'm working on to go off of what Crystal and Tara have mentioned. I get to help with clinical payer programs like CPSN, Elevance. I'm actually stepping into a board position role with CPSN just because I really enjoy what we're doing and I want to help further that even after residency. So I'm very excited to be doing that. And Crystal and I worked on developing and updating the CDTA to make sure we can do some of that chronic disease management. We also have been, especially with some of the things that have been going on with the vaccine updates, her and I worked together to make these vaccine update summaries and send that out to the owner so that everyone's on the same page, just making sure that it's just seamless. That's a really big bonus, like Jeff mentioned, of that CPG network, just being able to support everyone. I have so much more that I could say, but I know that I'm don't want to take too much time. And I'm absolutely always available for questions, just as much as I know everybody else here is absolutely available for answering questions. You can always email us. We're always available. We're very passionate. And so we're also very passionate about answering your questions. So I wanted to put that plug out there as well.
So also here is a QR code that links you to our website. We have a residency banner, but we also have an internship page that talks about experiences. If not everyone on here is probably a last year student. So we do have both IPPE and APPE opportunities. One of the things we did as we kind of came into the office was help create infrastructure to support collaboration with many universities, and it's growing. We've got colleges reaching out each year and kind of adding to who wants to come see what it's like to be at Cascadia Pharmacy Group, which is super neat. We have a traditional community practice rotation, the core component, but we also have a core clinical ambulatory care rotation in some of our stores. As we've said, I know Jeff says AmCare is community pharmacy. And so some of our stores are truly robustly medically billing, doing these services in a really robust manner. And so a couple of our stores, we do have that core component of AmCare. And then we have 2 electives, one's in compounding, and then one's in management ownership. So really spending 6 weeks understanding the nuances of managing with an independent community pharmacy and or also of owning a community pharmacy one day. And those are really, really unique elective opportunities. Highly recommend thinking about those. If you don't see it listed for a site you're interested in, you can always work with your college too, and they can work with me and we can see if we can make it available. And then lastly is the remote business administration rotation, where I loved that photo that Amanda shared of everyone with their hearts. That was such a fun block. We had a lot of students, we had our residents kind of finally getting their feet under them, past orientation, and we just accomplished so much in those 6 weeks. It was incredible. And everybody loved it. I mean, the vibes were just such a family in their own little ecosystem of remote learning. And I think all of them are really sad to move on to their next blocks, and we were sad to see them go. So we're looking forward to a lot more blocks like that in coming months as we get on the other side of the holidays. So yeah, so something to think about for those of you who are earlier on or have friends that are in lower classes. Reach out to us if you've got any questions. I think Crystal was going to talk about LinkedIn.
Yeah, this is our LinkedIn. So if you are new to hearing about Cascadia Pharmacy Group or want to stay in touch with what are we doing, what are our different stores doing, who are some of our people, where are we going to pop up next, at what meeting or residency showcase, Julie is our marketing director and she does an amazing job running our LinkedIn. We got so many comments when we were in CPA about how great it is. There's a lot of information about just current events, legislation. The NCPA fly-in is coming up. And so just, I encourage you to follow our LinkedIn. Julie does an amazing job with it. And it is made a lot easier because we have such cool pharmacies doing so many innovative things that Julie gets to highlight all the time. There's also been quite a few awards lately too. So those are always fun to highlight as well, but follow along. We would love to connect with you on there as well.
In a time of where sometimes there isn't always exciting news surrounding pharmacy. Jeff's done a great job of bringing together a lot of people who are really pushing the envelope in pharmacy and a lot of exciting things to share. So it's kind of a good news page, I think, for sure. And so next is just a little bit more of the passion behind what we've been building at Cascadia Pharmacy Group just as a whole in our organization. We were able to obtain a grant with collaboration with Oregon State University to help fund a video. And if you haven't seen it, it's on our YouTube. We've got the QR code there on really what do pharmacists do and how we do so much more than fill prescriptions. So we titled it Beyond Prescriptions. And it's really designed for, I say like my kids' parents who don't know anything about pharmacy. So not us and our colleagues, we're really good at telling each other what we do, but helping the general layperson who doesn't have a family member who's a pharmacist understand pharmacists do so much more than, like Jeff said at the beginning, lick, stick, and pour. And this video, a lot of national organizations picked it up. It played at conferences. And what's really neat is after Jeff's presidency at NCPA, we were working actually with NCPA to come up with kind of a pharmacy slogan. If we all think of this saying, got milk. Everybody recognizes it. It's not tied to a specific brand, type of milk, chocolate or white milk. It's just got milk and the benefits of milk. And so we're coming up with a slogan that we can really try to push across our profession that helps the general public know what we do as pharmacists and what we can do, and have patients knocking on our doors saying, help me for clinical services, like we saw happen during COVID. They knew to look to pharmacy then, but we haven't re-hit that point now. And so we'll be using, we got additional grant. We're going to be putting up billboards along in Southern Oregon and kind of telling local and national stories around that. And it's going, and I know NCPA is doing a lot of initiatives as well around this as well, of the slogan to help promote the profession. So just in one of the many, many ways that we help push that envelope. So with that, I think we are ready for some questions. We've got our contact information up here on the screen. And I do know that Julie said that there was a question put.
Yeah, this is the second year of CPG residency being available. What changes, if any, will be made to the program for this upcoming year?
That's a great question. So So first of all, number of sites. So we'll see how it all kind of lands with the match and everything. But I think already just those three residents having each other, I watched that community that they have with each other and the ways that they get things and share an idea share and bounce. I think it's even going to be a stronger network with there being even more residents, and our business admin remote rotations having built out really creates this complete learning ecosystem that's just unlike, I think, any other opportunity across the country. And that is definitely going to be a difference, because they were like, we're like, here's your residency, here's your idea of a manual, let's massage this. The other thing is our learning experiences schedule that we put up there. It's similar to what it was last year, but Amanda actually works closely with me on that. And one of your projects you didn't talk a lot about was all the marketing things you've been doing, and career fairs and webinars and all that stuff, and a website build. But we reorganized a bit our learning experiences to really say, okay, in the stores, building clinical services in the stores, thinking about how you elevate every single team member in that store about half the time. And then the other half the time, how you're connecting to the greater ecosystem of the university collaborations, the leadership, professional engagement, Cascadia Pharmacy Group, and all your other amazing 45 stores. So you don't have to just learn from one store or two stores. You're learning from 44 stores, 45 stores, 50 stores, 60 stores as we grow. So we did regroup that structure a little bit. Okay, so we had some other questions. I think, Amanda, you dropped all those in the chat. I know one that,
and sorry, I was going to say one of the ones that kind of ties into what you were just talking about with the schedule was, like what does a day-to-day look like for me, or like, I guess a week to week in this case. And I would say like my residency schedule looks very similar to kind of that classic structure that we were just like talking about. But because we're non-accredited, it's such a big bonus is that you can really follow your passion. So like one of my passions was doing a lot more like clinical program things and almost like project management. And Crystal and Tara heard me when I said that to them when we had lunch, and they said, okay, we're going to like tailor kind of your residency towards this path. And Michaela and Goldendale gets to kind of go do clinical services and medical billing and diving into that realm. And then Anna also gets to do a little bit more staffing, because she really is passionate about being like a really good pharmacy manager one day. And then Michaela also wants to be an owner. So she's learning very closely hand in hand with her owner. So it's very flexible. And so I do kind of like the 3 to 4 days a week in pharmacy, flexing and working bench, learning how to be a pharmacist, getting a lot of experience with that, then getting to do the clinical programs, project management, working with CPG. I'm doing the UW teaching certificate, so I get to work with like my professors there that I was with. And yeah, it's just, there's so many opportunities that I would have never gotten to experience, and very much match my passions for what I want my career to look like.
yeah, and if anyone else has any other questions that have kind of come to mind as we've been talking, we'd love to answer those. But again, thank you to many of you for pre-submitting questions. Jeff, I'll throw you one of the ones that was kind of pre-submitted before, which is just kind of looking forward of how you see how Cascadia Pharmacy Group and you see the future role of pharmacists in the community and independent pharmacy looking. I know we're kind of, everybody's saying pharmacy is not going to look the same. How do you see it looking?
I think that legislation is on the verge of getting passed. I mean, we've put a lot of effort into legislation at the state and the federal level. And I think that, now that they're back to work and they're going to have to pass something before, I think, January 30th to have another continued resolution. I think that we're going to be in that. And I think that that's going to be the key for federal side to get the needle moved there. But as far as pharmacy goes, the sky's the limits. I heard that there was a couple Georgia people on here. I think Crystal said, and I was just in Georgia in Athens last weekend for the Texas Georgia game, and for those, I guess it's horns down, right? So. But I met a pharmacist there. I was at a tailgate party who was going to plug me in with how do we do these clinical services and get paid for them? And this model that he's built there is unbelievable in Georgia. And so it's those networking things that I pick up on and bring back to the team that we build out. So our growth has been insane at the individual store level, not our store count, but at the individual store level from about April till now, with the consolidation. And the patients are coming to the quality, and we are the quality. We are the premium product. Rite Aid left and went bankrupt for the second time and officially is gone. Those patients came to us and they didn't even realize that pharmacy could be practiced like we practice it. They're like, wow. I mean, where have you been? Why have I not been here before? Et cetera, et cetera. And so we're in a new era of pharmacy where there just isn't as many, and the quality is going to rise to the top. And so we put this effort in. As you can see, the girls have done a phenomenal job. They talked a million miles a minute to get 3 hours of content in 45 minutes for you guys. And so it was fantastic. You can see their energy, you can see their passion. And that's really where we're going. And really, I want to cash the check that my mouth writes, and that's I want more clinical services in our stores and being billed at a quality price for those, so that we aren't stuck behind the script. The script is not going away. The script is going to be always there. The script drives the revenue, but the opportunities for you guys, and if I hear ambulatory care one more time and that it's only related to a hospital or an institution or something, I'm going to scream. We are ambulatory care. I mean, independent pharmacy founded ambulatory care, and disease management, all these different things that you're going to have the opportunity to do. We at CPG are building out right now. So the future is bright, and I think when you pair that with legislation, reimbursement's going to get better. And it's only going to allow us to expand those services and build those out. So,
yeah, I couldn't agree more. I'm very much looking forward to it. Okay. Or go ahead.
I picked another one that was submitted earlier. I want Amanda's perspective on it.
I bet we picked the same one.
Is it number 3?
Oh no, I was going to ask no. Oh yeah, it is, because I broke yes. Mm-hmm.
Because you did a rotation with us first before you chose to do a residency, what advice do you have for someone interested in doing their APPE IPPE rotation with CPG, and for someone who wants to be a CPG resident?
Well, definitely, number one, apply to be one of our rotation students. I know, especially for the younger students who still have that upcoming, or at least keep it in your back pocket and know that we're here. There are many opportunities to, especially even, I saw we had a question about, someone who's on the East Coast who wants to come over to the West Coast. We have at least a site or two that could potentially house you. I know Josua, our Forks location, he actually would be willing to room and board you and pay for like a food stipend, basically, as long as you can fly over and get over here, pay for that flight, he will house you. So I really, like I said, hindsight 2020, I wish I could have done more APPE rotations with CPG because I feel like it would have prepared me even better for the residency. In terms of, if that's maybe not as feasible, or you have to do something else with because of your school or whatnot, I would say, and you're passionate and you're passionate about doing a community pharmacy residency, I would say try to pad your rotations, your APPE rotations, with as much independent community pharmacy as you can, because that is truly where you're going to get the most benefit from a community APPE rotation. That's where you're going to be able to do a lot more, like all of the things that we mentioned today. Like the chain pharmacies do give community pharmacy, but it's more of that classic dispensing, and you're just not going to be able to get as many cool opportunities. I usually say, if you're unsure, then, I used to say, if you're unsure, then do a diverse, experience, because, but I was always the type of person that knew exactly what I wanted. I did mostly ambulatory care and community rotations, except for my minimum required core ones. So I did my hospital one. I was like, this is cool. Okay, now moving on to my other one that I absolutely am passionate about in community. So, and like I mentioned as well, reach out to us, we can connect you with preceptors if you're interested. They are very welcoming and open and would love to speak to students who are interested. We have my my actually preceptor, Matt Binder, is the WSPA, I'm sorry, the NCPA Preceptor of the Year. So he was honored with that this last October, and very honored to be his student and resident.
Yeah,
I'd like to
absolutely.
add to that too, because it's one of my soapboxes that I like to hop on, is that even if you get a rotation that isn't your top choice or isn't ideal, pour your heart and soul into it and drive that rotation and make it yours, right? You have 6 weeks on any rotation, or 4, depending on your school, to really get the most learning out of it. Even if it's learning what you don't want to do or what preceptor style you don't want to be when you grow up. These are things that you can take away and develop as a person and as a professional. And so no matter what rotation you're on, pour your heart and soul into it. You're going to get out of it exactly what you put into it. And then I would also say that if you're, especially if you're with CPG and you want to be a CPG resident, then treat that like a 6-week interview. Both ways, right? You're going to pour your heart and soul into it. So we definitely say, we want Amanda Bryan to come with us and get to know, ask questions, get to know us, so that then you're also interviewing us and saying, is this a good fit for the next year of my life? So remember to take things both ways, but you can get something out of any rotation.
Awesome. Well, I know we are at time. Thank you all. We have multiple questions that were answered. So I think a lot of them though the answers were kind of intertwined throughout our presentation. But if you do still have additional questions, our information's up on the screen. I know Amanda, you mentioned you maybe would be open to hosting a resident Q&A session too, if anybody was interested in something you were kind of thinking about doing.
Yes, so I am thinking about that. So then I was going to collaborate with my co-residents, Michaela and Anna, and then we can get with Julie, and we'll be like blasting that out onto like the LinkedIn pages, and I'll try to make sure we get that set up on the website as well, so we can potentially get people to come and just do maybe like a roundtable, very chill discussion, like answering questions.
So, and we will be sharing the recording. So if you know anybody who you think would be great to share, or you want to rewatch, we'll send that out. And thank you guys so much for spending this evening with us. We really appreciate it. I hope everybody has a great rest of their night.
Thank you, everybody.
Thank you,
Have a good evening.
everyone.
Thank you.